Hello Americans. Today we're going to talk about healthcare. And healthcare is kind of a complicated subject, and it's actually got several parts. I think 4 main parts. I know quite a bit about healthcare. I was trained by American Hospital Supply in healthcare management and hospital management, and actually was a contract manager in several hospitals working for American Management Systems, which was a division of American Hospital Supply Corporation in the early 1980s. During that time, I spent some supervisory time in San Francisco General Hospital and in Yakima General Hospital in Yakima, Washington. And I was in charge of, among other things, infection control. So I know quite a bit about the operations of hospitals and how to save money in hospitals. In order to talk about healthcare, most of the public's attention has been directed to the costs of healthcare. The idea that healthcare is going to keep costing more and more money and eventually bankrupt us. The concern is the cost of Medicare. Now, I guess we have to talk about what my general idea of healthcare is. And I think healthcare is a right. And so we need to have some government involvement. But healthcare is one of those peculiar things that needs also some market force controls over it. So it needs some competitive influences. So we have to break healthcare up into 4 different parts. One is the emergency part, where people get heart attacks or they collapse and of a stroke or something of that nature and need an ambulance and a hospital care, emergency room and care. All right, the second one is health care that you can shop for. So routine health care, routine hospital visits, routine doctor visits, things that you can shop for on your own that don't need instant response type of thing. All right, the third aspect of healthcare that we have to concern ourselves with is insurance, which is really different. It's lumped into healthcare, but it's a different aspect of healthcare. The fourth aspect is the impact of healthcare on our economy, and we have to understand the fact that dollars spent in healthcare aren't all bad, because of the fact that for every dollar that's spent, there's a company out there, and most likely it's an American company, making money off of the healthcare system. So we have to be alert to all 4 of these different aspects of healthcare. Healthcare, why does it cost more? Well, healthcare costs more because it improves our quality of life, but the cost of science and technology continually goes up. And what's happening is that's extending our lifespans, but it's also exposing us to the need for more and more health care. We've added years to our lives. We've also added years to the time that we need health care. All right. Also, it gets more expensive. The older you get, the more expensive health care is, because the more in-depth, the more things you need in health care. So we don't want to discourage the cost of healthcare going up. It's important to us that it does. It's a 16% of our entire GDP is healthcare, which is on the order of $2.4 trillion. Another thing that people don't understand about healthcare is that government regulations cost a lot of money. It costs almost 30% of your hospital bill or any medical bill just to pay for the regulations that the government has imposed on healthcare. So when you pay $10 in healthcare costs, $3 of that is going to the government in some fashion. So we can save a lot of money just by dealing with the government's aspect and involvement in healthcare. So, all right, now what do we do about healthcare? Well, we don't want to discourage it, we want to encourage it. It's going to cost more, yes. What we have to do is we have to deal with that, all right? Not eliminate that. All right. A lot of the problems with healthcare deals with the fact that it's not efficiently delivered, and the fact that there aren't a lot of people with health insurance, or there's people that can opt away from taking health insurance. We have to change that. Health insurance needs to be, or health care has to be brought down into two basic considerations. One is the emergency aspect, the other one is the aspect that you can shop for. The emergency aspect should be a function of government, like a fire department. You wouldn't want the fire department to be something you shop for. You want that to be an emergency response, and that you want to be government supported. So all of ambulances, all of emergency care, all of that type of thing should be part of our taxes. We should pay taxes on that, and that should be free for everybody. All right. Now, the part that you should shop for, that has to be analyzed, because now you're dealing with routine medical care, but you're also dealing with what would be called catastrophic health care. You're not necessarily rushed to the emergency room for cancer, but it certainly is a catastrophic occurrence, and it costs one heck of a lot of money over one long period of time, and it also ends up in possibly in death. All right, so that's another aspect of that, of health care. What we need to do in the cases of that, in my mind, is not regulate that health care, let people shop for it. But what we have to do is have government-sponsored insurance. Insurance is a weird animal. Insurance doesn't really work very well with the profit motive. Also, insurance is meant to deal with spreading a risk, and you want the risk to be spread over the largest possible population. Well, the largest possible population in the United States is the entire population of the United States, which is what, 315 to 320 million people. All right, in which case, the most practical way to deal with insurance is to have the government be the insurance agency for health care. That guarantees everybody gets health care, and have it start from birth and run all the way through death. So the government's then in the insurance business. I don't, however, want the government to be in any business, really, because the government doesn't run things well. The bureaucratic system is set up so that it expands, it runs by rules, it doesn't have a profit motive, it doesn't have any competition, so therefore it runs amok and costs a fortune. So what we need to do is, if we want to have government-run insurance, we have to bid it out and have private companies run it to ensure that we get the best bang for our buck. And that's a function of government. So now what have we dealt with? We've dealt with health care, the fact that emergency health care should be tax supported, the fact that catastrophic and routine health care should be something that we expose to market forces and shop for as individuals. But the factor involved there is the insurance portion, which needs to be another either government function or treated as a utility. So the government needs to be involved in healthcare, but not all of it. It needs to be involved with just pieces of it. And this is where the government has let us down in the past. Healthcare does not respond well to, like I said, to the profit motive, so we have to deal with it as a utility. And I believe that the best healthcare is under the government auspices, but with private input. Thank you so much for your time. Bye now. Thanks for watching. I encourage you to go to proud.com. There you can donate to my campaign. You can read my biography and qualifications for the presidency. You can also, from there, go to americanselect.org and click a support vote for me. I'm Jeffrey David Proud, and I approve of this message. I made it.